I now request Obioma Chijioke-Akaniro to present on the topic Determinants of Antituberculosis Drug Acceptability among Children with Tuberculosis in Osun State, Nigeria. Over to you.
Okay, good day, everyone. My name is Obioma Chijioke-Akaniro, student of Texila International School. I am presenting today on determinants of antituberculosis drug acceptability among children with tuberculosis in Osun State, Nigeria. I just want to start by stating that Nigeria is one of the high-burden countries with TB meaning tuberculosis, and to also bring to our notice that we are sixth in terms of high burden globally, and in Africa, we are the first. That is the highest burden in Africa. And to state that over the years, the disease tuberculosis has been treated using the DOTS therapy, that is the directly observed therapy, in which the patient is observed daily swallowing the drugs because of the length of time it takes to treat, which is minimum of 6 months and sometimes gets to 12 months and even sometimes got to as much as 24 months. Now, for a disease with such length of treatment, you would see that the adherence is very important. And by that, the scientific community has worked on finding a way to make sure that these drugs is acceptable among the patients. And that's why acceptability of antituberculosis drug affects caregivers, and as it affects caregivers and the patients is key to disease elimination. Also to state that the children being an important factor in % of the burden in Nigeria. And previously, these children are treated with the same drug formulation as adults, only that theirs will be ground, mixed with water and given to them. Previously, this drug given to the children, we call it the old loose drug formulation, in which, as the picture you're seeing, they gathered the drugs, each of the drugs, the rifampicin, the isoniazid, the ethambutol, and it's ground for the children and mixed with water to be given. So it's also known that there are many factors that affect this acceptability, and that is affected by many factors such as the drug itself, the formulation of the drug, the patients, the kind of patients, if it's an easygoing patient or not so easygoing patient in terms of taking the drug, or the health institution related factors can also affect the acceptability of those drugs. And all these factors has been looked into over the years to improve the adherence of the antituberculosis drug. So this study aims to assess the influence of introduction of a new therapy, which was introduced recently in 2018 for the children, to make the administration of the drug to children less cumbersome. Therefore, they divided and worked further to ensure that the drugs given to children is not same as that given to the adults. So a drug called a dispersible formulation was introduced, and this dispersible formulation was actually sweetened such that if you put it into water, it changes, disperses into something like a strawberry drink, as you can see in the picture, which is held by the little girl in the slide. So it aims to assess the influence of introduction of this dispersible formulation on the acceptability of antituberculosis drug among these children. For the methods, we did a historical cohort design, and we had to assess and compare acceptability of this old loose non-dispersible one and this the new dispersible drug. So we used a mixed method, a convergent mixed method, which is we did a qualitative and quantitative, in which in the quantitative we used a data extraction tool to look into the treatment records of these patients, and in the qualitative we had to do focus group discussion for the caregivers of these patients to be able to triangulate between this quantitative and the qualitative data. For our study population, it was children under 14 years old, and they were in two groups. We had 127 children who were treated using the new dispersible formulation, and we had 124 children that were treated using the non-dispersible formulation, or rather called the old formulation. So in determining acceptability, what we did was that we used the summation of responsive to 5 key questions on drug formulation, and a score of 50th percentile and above was regarded as good acceptability. At the end of that, with the results we got, we also went further to use binary logistic regression to look at the strength of a relationship within this. And just as I mentioned, the quantitative and qualitative data was going on simultaneously, and we're able to triangulate the responses from the qualitative with the quantitative data, which we also analyzed. So from the results, we saw that the rate of acceptability of the new dispersible formulation was 82%, which is 112 out of the 127 had a good response in terms of that. And this was higher than the rate of acceptability of the old loose non-dispersible drug, which is 10.5%, that's 13%. And this is statistically significant at P level less than 0.001. To state that the median age of children with good acceptability was 7 years, which is 4 to 10 years. And it was significantly lower than those with poor acceptability, which is 10 years. That's a range of 8 to 13 years. And p-value less than 0.001. This chart shows in a nutshell the acceptability comparison between the new dispersible drug and the old non-dispersible drug. And from the comparison between the two, you will see that the new dispersible drug had 88.2% responding better in terms of the acceptability. And for the old dispersible drug, we just had 10.5%, with about 89.5% having poor acceptability to it, with p-value less than 0.001, showing statistical significance. So these are the 5 questions that we required responses to, and it ranges from, in this table, you see that the variables is compared between the new dispersible drug and the old single dose non-dispersible drugs. And you see from the first one was the caregiver's feeling about the preparation of the doses. And you see that for the new dispersible drug, we have a lot more of the caregivers have a good response in terms of feeling that the preparation was a lot easier and non-cumbersome for them. And that was about 88.2%. And for the old dispersible, we have less, that's about 20 out of the 124, that's 16.1%. who agreed that it was easier for them, in which a lot more, 83.9% of the caregivers express their feeling about the preparation, and it was poor. The second one was the ease of dissolving the medication in water. So you will see that the new dispersible will have 96.1% who showed that the new one was easier for them to dissolve in water than the old one, where we had a lot more, 81% who stated that it was poor in terms of being easy to dissolve in water. So we got to caregivers' feeling about administration of the drug itself. And we find out that for the new dispersible drug, 95.3% of the caregivers, that's 121, believed and also expressed that administration of the new dispersible drug was easy. And if you remember the picture I showed of the child in the second slide I presented, you see the child smiling as he was holding it, as if it's about to take a cup of juice. And for the old dispersible one, we had more of the caregivers who said administration was not very easy for them. And by that, we have about 81.5%. And and just about 18.5% who expressed that administration was good for them. And all these were statistically significant at P level less than 0.001. Then we looked at the caregiver's perception of the taste of the drug. So from their perception, you see that for the new dispersible drug, we had 74.8%, that's about 95 of these caregivers, who showed that the perception of the taste of the drug was good. And we had 25 of them, that's about 20.2%, who showed in the the old formulation that showed the perception of the taste of the drug to be good. So seeing that the new formulation also had a lot more caregivers attesting that the taste of the drug was better for the children, and at a P level less than 0.001, showing statistical significance. So we looked at the child's feeling about the taste of the drug. And for the new dispersible drug, we had about 78% of the children, that's about 100 out of 127 children, who attested about the taste of their feeling about the taste of the drug. And this 78.7% attested that it was good. When compared to the old dispersible, we had just 15.3%, that's 19, that attested that it was good, meaning that more of the children attested that the old formulation wasn't tasty. And that also shows a significant statistical significance at P level less than 0.001. So in a nutshell, the drug formulation was a significant predictor of acceptability of the fixed dose dispersible drug. And it has shown clearly that this new drug formulation actually had a better acceptability compared to the old one. And from the qualitative data, it shows that health education about TB, tuberculosis, had positive influence also on this drug acceptability. So we went on to look at the extent of this relationship by doing a binary logistic regression of association between the selected participant characteristics and the acceptability of this anti-tuberculosis drug. And we had these variables where we looked at the educational status of the child, and is it an out-of-school child or a child who is in school, to further check if to check the relationship, how strong the relationship between this factor of acceptability was. So in looking at these variables, we found out that the education status actually didn't have influence on this, because the p-value was not of significance, 0.2. We looked at the knowledge of TB, if it was poor or good. Looking at it, we saw that the p-value wasn't significant. But when we looked at the type of drug, if the single dose, the non-dispersible one, that's the new drug or the old drug, and we found out that at this time, the p-value was less than 0.001, showing statistical significance that the type of drug also is exactly what's buttressing the factor of this acceptability. So we looked at the age, and we saw that the age of the child wasn't really statistically significant. So in conclusion for us, we identified that the formulation of drug is a key factor in the acceptability of anti-tuberculosis drug. And the importance of this for us is that since the initiation of this new formulation in Nigeria in 2018, there is no study that has gone in to actually check if this drug has a better acceptability among the children who are diagnosed with TB in Nigeria. So this particular study is a kind of factor to help us endorse that adapting to this new trend of using the new formulation, which actually, though more expensive than the old formulation for children, actually will give a better outcome as it has a better acceptability among children. So we conclude also by saying that there is a need to further promote the recently introduced child-friendly anti-tuberculosis drug, coupled with strengthening the health education of caregivers to achieve tuberculosis elimination. And with this result we have gotten, it will also help us to buttress the fact in the country that for all the other states where the old drugs is still being used, that they should be phased out and the new drugs introduced in all those states starting from this period. Thank you.